नमस्कार, सत श्री अकाल, आदाब, गुड मॉर्निंग, गुड आफ्टरनून, गुड इवनिंग, जहां से भी आप हमें सुन रहे हैं. थैंक यू फॉर ज्वाइनिंग आवर लाइव सेशन. माय नेम इज आरजी कुंजन. हमें आपके होस्ट और दोस्त फॉर टुडेज लाइव सेशन. These are unprecedented, unpredictable times. Tell me something. Did you ever think it's possible to have the most experienced, highly qualified, compassionate doctors at the click of your button? Well, eGlobal is the answer with affordable, secure web application, online healthcare, remote consultation, membership options, personalized health password, and many more amazing features. In today's Facebook Live, we will be exploring and providing more information about kidney health. We have with us Dr. Anjali Acharya. Dr. Acharya obtained her MBBS degree from India, has a graduate diploma in gynecology. She also completed residency in internal medicine from Albert Einstein College of Medicine in New York. She obtained advanced training in nephrology at the fellowship program at Albert Einstein College of Medicine. She's a board certified in internal medicine and kidney specialist, and she is a member of medical advisory board at National Kidney Foundation of Greater New York. It's so nice to meet you, Dr. Anjali, virtually. Thank you for sparing time. I know you're super duper busy. Welcome to FB Live.
Well, thank you, Kunjan. Thank you for that generous introduction, and happy to be here today.
So how are you feeling, and how's the weather in New York?
Well, I'm feeling well, and actually it's quite warm for this time of the year. So we're happy about that, not complaining, but I feel bad for the others who are suffering across the country with unprecedented bad weather.
Thank you. We are very happy to have you. So tell us about your background, your clinical experience, and how are you associated with eGlobalDoctors?
Yeah, well, like you said, I'm a board certified physician in internal medicine and nephrology, and I have been working in the Bronx with the underserved population here, which has been my passion ever since I graduated, because this is the population that's at very high risk for kidney disease. And this is the population that doesn't have easy access to care for kidney ailments. So I've been here for almost over 21 years. And I'm also very intimately involved in teaching medical students. I run the fellowship program. So very involved in teaching at the medical school as well as at my hospital. And in terms of eGlobal, telemedicine has been around for a while. It's nothing new, but the adoption of telemedicine was very slow until COVID hit. And now it's just let out of the bottle, right? And it was just at the right time that eGlobal, I think they've done a phenomenal job in deploying this very urgently with a sense of urgency when India needed it most. And I've been very fortunate to be associated with it right from almost the very beginning. And we've been able to provide, it's just been very rewarding to be able to provide some advice to the our folks at the other end of the world who were really struggling. Like, a lot of other medical systems were also buckling. It's not just in India, but we were able to connect people. For those who needed reassurance, we were there to provide that. For those who needed escalation of care, we were able to advise that. So I think this tele-triage was just it came in at a very useful time for people who were struggling in India. So I've been very, very fortunate to be associated. And, I just want to add, it's not just helping them out, but I think there's also this phenomenon of us feeling good about it, right? It's called some sort of a reward that we get for helping people out. It helps us deal with the pandemic and the struggles that we all as physicians are going through, seeing all the suffering. So it's been great.
Well, wonderful. You put it great together. I do agree. Being at the right place at the right time makes whole lot of different, and I think that's what eGlobal did. So thank you. It's a wonderful platform to give back to the community. So I totally agree with you. The feeling and the reward are just unmatched to anything. So thank you for that, and we are so grateful that you are part of eGlobalDoctors. So for the people like me who don't understand medical terms, I'm sure a lot of people who are watching us, they don't understand the fancy word that I use to introduce you, and hopefully I will not butcher the name. It's nephrology. So what is that term? Explain it to us for someone who is like non-medical like me.
Yeah, you got that right, nephrology. So it's a field, yeah, exactly. It's a field of medicine that deals with kidneys, right? So what I just want to say what the kidneys do, just in a nutshell. The kidneys, each one of us, most of us, have two kidneys. They're located in the back, right under the rib cage. And what the kidneys do, they're about the size of a mouse. I would have said a fist, but now with the new generation, Gen X, I think a mouse, computer mouse makes some more sense. You know, they will understand it better. So they're small, but they perform many complex functions in the body. Most important of which is cleaning the blood and getting rid of all the waste and getting rid of the excess fluid, or any fluid that we consume that the body doesn't need is excreted in the urine by the kidneys. So that's the basic function, but they also do many other functions. For example, they make hormones that help us make fresh blood. They regulate minerals like calcium, phosphorus, and potassium. And kidneys also help us regulate blood pressure. So they do a tremendous amount of work. So that field is called nephrology. And a physician who takes care of patients who have diseases pertaining to kidneys is called a nephrologist. And in addition to taking care of kidney diseases, nephrologists typically also take care of difficult to treat hypertension or blood pressure, high blood pressure. They take care of patients when they run into trouble with fluid balance, or treat patients who have electrolyte abnormalities like mineral abnormalities. Take care of patients who are post-transplant in terms of providing them with the medical care. The surgery is done by the surgeons, but then the patients need long-term follow-up. And we also provide hemodialysis care to patients when their kidneys have failed and they need support. So that's kind of the broad, description.
Wow, that's actually enlightening. Never knew kidneys were that important. So thank you for being there for us. If we need, we know where to go now. So when I when I heard the term kidney, the first thing that flashes in my head is actually chronic kidney disease. I have heard that term a lot. So what is actually chronic kidney disease?
Right. So as the term implies, chronic means it's been around, it's been there for a while, which means in our definition, what's the acceptable definition is about 3 months or more if you've had any abnormality in kidney function or in urine abnormalities. For example, if there's protein in the urine or blood in the urine, or the third category is if you have any abnormality on imaging, what that means in an ultrasound or CAT scan. If you've had that for more than 3 months, then that means that person has chronic kidney disease, as opposed to acute kidney injury, which means it has happened acutely within a few hours or a few days. So chronic kidney disease is a long-term effect.
So a prolonged problem with the kidney is CKD. Yeah. So I don't know if I have any problems with my kidney. So how would I know that he or she has CKD?
Yeah, I hope you don't, but I hope no one ever has to deal with it. But yeah, that's a very important question. And I can't stress how important that is, because unfortunately, or fortunately, the CKD has no symptoms. It doesn't manifest with any symptoms early on. It's only very late in the stage of CKD that patients start experiencing symptoms. And typically in the early stages, by the way, it's divided into 5 stages, CKD stages 1 to 5. Stage 1 is mild, and as it progresses, as you reach stage 5, it means your kidney function is almost nil or less than 10 ml per minute. And that's when patients need to go on dialysis, a lot of them. So as the decline in kidney function happens, they start experiencing symptoms. And so the common symptoms later on are like loss of appetite, nausea, vomiting, urinary abnormalities, decrease in urine output, swelling of the face and feet, shortness of breath. These are all that come on later, but initially the patients don't experience any symptoms. So it's very important to keep that in mind. So the next question is, how do you then know that you have kidney disease? That's
Right.
your second part of your question was, how do you know?
Mm-hmm.
So certain patients are predisposed to having kidney disease. And when you have any of those conditions, for example, diabetes or hypertension, about 75 to 80% of the patients with CKD have those two conditions. So if you have those two, it becomes imperative for the physician to check the kidney function by doing two simple tests. You can do a blood test and you can do a urine test for protein. And if those come back abnormal, then you know that the patient has CKD, though they have no symptoms of it.
Understood. Okay, so if an immunity has been compromised, then it's worth having the test done, and the test could be a urine test or a blood test.
That's right.
Okay, so now what is the course of the disease after somebody has been diagnosed with CKD?
Right. So as I mentioned, CKD usually happens secondary to an underlying disease. It's usually diabetes or hypertension, but there are other conditions as well. For example, inflammation in the kidneys, which is called glomerulonephritis, all these fancy terms, but I'm going to keep it simple. There could be other inherited conditions, for example, polycystic kidneys, or sometimes people are born with abnormal kidneys. So all these could lead to CKD. So it depends on what the underlying condition is. So let's say you have uncontrolled diabetes, the disease in the kidneys is also going to be uncontrolled and is going to progress. So the bottom line is it depends on how the underlying condition is doing. So either you have progression of CKD or you have just a CKD that's stable, that has not gotten worse. So very rarely we see that it's getting better, but that's, highly unlikely. Once you have CKD, it's there to stay.
Okay, understood. So that's the course. We know what CKD is now. So now that we have established that somebody has a kidney disease, how can we slow the progression of this disease? Like, can it be slowed, or once it's there, it's just there?
Yeah, well, that's another very important question. And I think people need to understand that. I'm just going to stick with diabetes and hypertension because that's like the bulk of the reasons why patients develop CKD. So for example, for diabetics, it's very important to keep their blood sugar under control, their diabetes under control, because when the diabetes is uncontrolled, it affects all organs in the body, and kidneys are no exception. So it'll start affecting the kidney function as well. So that's number one. The second important point is to keep the blood pressure under control. So even for diabetics, as well as for hypertensive patients or patients with blood pressure, high blood pressure, controlling the blood pressure is very, very important to keep it under, what we call acceptable or normal ranges. So those two are prime, but obviously there are other things that go into leading a healthy life. For example, for all of us, right? Like eating a healthy diet, exercising every day, low sodium diet. It is important for everybody, but it becomes even more important when you have CKD and hypertension to be on a low sodium or a low salt diet, not to add too much table salt to your diet. So anything, we say 2 grams, that's a medical term, but in terms of the table salt we add, it should be less than 5 grams of sodium chloride that we recommend to our patients. So blood sugar control for diabetics, blood hypertension control or blood pressure control for the hypertensives and the diabetics, and then general lifestyle modifications. 2 other things I would like to mention: if it's a patient who smokes, smoking cessation is important, just as important it is for the heart health, for lungs. It's also equally important for the kidneys for the patient to stop smoking. And one other point that is very important is a lot of times patients take pain medications, for example, which are over the counter, which don't need a prescription. Specifically, I'm going to mention the non-steroidal agents. They're called NSAIDs, or non-steroidal anti-inflammatory agents. For example, ibuprofen or Motrin. Here in the US, they go by Advil, Aleve, those trade names, but also, anything over the counter, herbal medications, you have to be very careful because these can affect the kidneys in a negative way and worsen the kidney function. So I can't tell you how many times we go through the list of medications. The patient is taking the ibuprofen like 3 or 4 times a day, but doesn't think of telling us because it's over the counter and they don't consider it a medication. So it becomes very important to go through this. It's simple, but it's very important. So for example, the patient has osteoarthritis and has kidney disease. We say, switch to Tylenol, or which is acetaminophen. In India, it's sold as Dolo. So instead of taking the ibuprofen, you switch them to something that's less toxic to the kidney. Same thing with herbal preparations. And then there are other agents. For example, before going for colonoscopy, a lot of times patients are asked to take a preparation to clean the intestines to do the colonoscopy. And some are not so good for the kidneys. And that's a question for the physician. Is this safe for my kidney? Especially the phosphate containing cleansers, right? And then lastly, I want to say antibiotics. A lot of times patients are taking antibiotics. Sometimes they have antibiotics sitting on the shelf and they say, oh, I have a cold, let me take antibiotics. That's not necessarily safe because the kidneys there could be an allergic reaction in the kidney and that could lead to chronic kidney disease. So all these are important. And one last item on the medication list is proton pump inhibitors, or pantoprazole is an example. Like for acidity, people take this all the time. You just go to the supermarket and take it off the shelf, right? That has been shown in a lot of studies to be detrimental to kidney health. So simple stuff, but important. So
that is actually true. I know I'm getting rid of my ibuprofen, or at least I'm putting it where it's not in my reach. So when I need it, I don't gobble a ibuprofen. So thank you so much for that.
sure.
So when you were talking, you mentioned a term dialysis. So what is that, and what other option does a patient have if they have a kidney failure?
Sure. So dialysis is basically a procedure which replaces part of the kidney function. So as I mentioned, the kidneys clean our blood and get rid of the waste. The waste is coming from body metabolism. It's coming from the food that we ingest, and the body needs a way of getting it out of the system, and kidneys are the route through which it comes out. When the kidneys are failing, the wastes are backing up, and those are that's the reason why patients develop symptoms when they get to very advanced stages of CKD. So what dialysis does is it provides an artificial way of getting rid of those wastes. So patients get connected to a machine, which then cleans the blood, and then the clean blood is returned back to the patient. So that's called hemodialysis. And then there are other forms of dialysis as well. For example, peritoneal dialysis, where we use the patient's own lining in the abdomen as a dialyzer, or as a mechanism to clean the blood. So we instill solution that cleans the blood, and then the patients stay on that, which is called peritoneal dialysis. So those are the two options, and obviously the best option is to get a new kidney, or it's called kidney transplant, where they get a new kidney either from a deceased donor, somebody who's passed away, or from a living donor. And living donors could be related donors, for example, a child or a parent or a cousin, or it could be a living unrelated donor. For example, a friend decides, okay, I want to help my friend, I'm going to give my kidney. Or it could be somebody who's truly altruistic and decides, okay, for the human good, I'm going to decide to give a kidney, and it can be done that way. So there are many different ways.
Okay. So you mentioned in the beginning of our live session, we have 2 kidneys. So if somebody gives one, can the body function like 100% functionable just with 1 kidney as well?
Yeah, that's an excellent question. Yes. We have donor registries, and what we've known over the years is that, yes, donating a kidney is not a problem for the donor, but obviously we want the donors to be not falling off the radar. They need to check their health regularly, make sure they don't develop any condition that predisposes them later on to a kidney problem, for example, high blood pressure and so on. Mm-hmm. And on the same lines, some people are born with a single kidney and they're okay. As long as the kidney is functioning well, it shouldn't be a problem.
Okay, wonderful. So you kept you reminded us, eat healthy, do exercise, do regular checkup, not too much. Everything in moderation is good, whether it's antibiotics or the regular painkillers that we take. These are some tips that I got how to keep my health, my body healthy or my kidney healthy. But what are the other things that people who are listening to us, they can do to keep our kidneys healthy, and any lifestyle or diet that they should follow?
Yeah, so in addition to low salt diet, depending on whether they have CKD or not, for example, if they have kidney disease, the diet will need to be tailored according to their stage of kidney disease and what other underlying conditions they have. For example, in diabetics, obviously they need to control their sugar, so they have to be on a low carb diet as well, right? And then they need to be on a low potassium diet because a lot of diabetics have problem getting rid of potassium, which is a nutrient, which is a mineral in the body, but the body needs it for good heart function, for good bodily function. But when there is excess of it, that leads to a problem too. So these are all very sophisticated and nuanced discussions that one needs to have with their dietitian and their physician if they have CKD, especially as the CKD stage advances. It becomes even more important. And health exercise, very important, just like for everybody else, right? You exercise just because you have CKD, it's no excuse. You have to exercise within the scope of things. If you have joint disease, obviously we understand you can't go jogging, we get that. You have to talk to your physician. If you have heart disease, don't do anything strenuous. So within the possibilities for your condition, at least I tell my patients at least 30 minutes, 5 times a week, try to do some sort of exercise, keep yourself active. And then I mentioned smoking cessation. So these are all very important. So one of the things, how do you keep track of your kidneys? Like we do with the cholesterol and with the sugar, it's very important to ask your doctor, what is my kidney number? What does that mean? It means there's a, like I said, easy way to figure out how your kidneys are doing. And that is called doing a blood test, which checks what is called the serum creatinine. And what it is creatinine is a measure of the toxin that are building up in the body that's coming from the muscle in the body, right? So we calculate, using that blood value, we calculate what is called glomerular filtration rate, and that's expressed as the percentage or ml per minute. For example, I said when you get to 15 ml per minute. So once you do a creatinine, you can calculate the GFR. So it's important to ask your doctor, what's my kidney number? Normal is 90 to 100 or above. If you are down to 15, you know you're getting into trouble. So that's what you need to do.
That was my next question. How would I know if he or she will tell me the number, but how do I know? So thank you for boiling it down. So I'm going to switch our gears a little bit. Dr. Acharya, if it's okay with you, I never thought in my lifetime that I will actually live and see a pandemic in my life, span. So now that we all are in this pandemic and we have been living and breathing a lot of stuff which is going around us. So I'm going to connect our CKD, the kidney issues that we are discussing, with the COVID issue. So tell me, what is the risk of somebody being a COVID positive if they are a kidney patient?
Yeah, you're absolutely right, Kunjan. I don't think any of us could have imagined that we'll be living through this. And I think this is here to stay, and we have to learn to live with it for a little bit longer. So in terms of CKD and COVID, unfortunately, CKD is not a good thing to have. And CKD goes along with a lot of other bad diagnoses, for example, diabetes, hypertension, heart disease, heart failure. So these are all fall into the same bucket of things that nobody wants to have. So patients with CKD, what we've seen from systematic reviews, from our own experience, that these patients are at very high risk of developing bad complications if they do get COVID. So what are the bad outcomes? They're at a higher risk of getting hospitalized. They're at a higher risk of going on a ventilator. They're at a higher risk of mortality. So all the bad outcomes are to be expected in patients with CKD. So my advice to CKD patients is be careful.
Okay. So, we know that precaution is the best awareness, and be aware of your surrounding, be aware of where we are these days, at least. Like you said, this is the new normal, and we have been living and breathing through a year and a half now. So what precautions can a kidney patient take when it comes to COVID? Like, we can't ask them not to go out, the life has to go on. So what are the precautions they can take?
Right, sure. So it's the same as anybody else. Maintain social distance, be vigilant, wear your mask, get vaccinated, get boosters, because these are very high risk patients. They were one of the first group of patients. They were included as high risk, and they were approved for the boosters by the CDC and the FDA. So that's all those things, and try to not be in crowded places, especially if you think people are not going to be masked. So these are all the precautions like all of us need to take, but more important for patients with CKD. And I just want to add, you mentioned not going out is not possible, especially if they are on dialysis, because they have to go to the dialysis clinic 3 times a week to get their dialysis, and without which they're risking their life. So it becomes a very difficult situation for them. And it is not that it's a one-to-one, it's not a single room where the patient is sitting by himself or herself, right? So it's usually a place where they're exposed to other patients, to other staff members. So it is a complicated issue. And all the dialysis units are taking extra precautions, super extra precautions in keeping their patients safe and masked and healthy as much as possible.
Yeah, so that's actually a wonderful reminder. We have to do what we can do to protect ourselves and everybody else who is out. And thank you to all our healthcare providers, because बोलते हैं ना कि भगवान हर जगह नहीं होते. That's why they created doctors. So thank you so much for doing what you guys do, and keeping us safe. And here I am talking to you, so thank you. So tell me, agar kisi ko kidney disease hai and they get COVID positive, what is the long-term effects? They are positive, then they recovered, everything is good. So what's the long-term effect when if you not you, but somebody with kidney had a COVID positive reaction?
Yeah, sure. So 2 things about COVID. So patients with CKD can get COVID, and patients without any kidney disease can get COVID and then develop kidney problems. So there are 2 ways to look at it. So your first question, what happens to these patients with CKD after they get COVID, if they survive and if they don't get into the bad complications. So there was a recent review that came out. They looked at thousands of patients, and what they found is this phenomenon of long COVID, which has not been studied with the kidneys, is actually true. It holds true for the kidneys too. So their kidney health doesn't go back to where they started off. They might have lingering effects, worsening kidney function, more of them getting on dialysis. So that's one possibility. The second one is they don't have kidney disease when they get admitted, but they do develop kidney injury as a result of COVID. And those patients may not recover. And some of them may need dialysis during the hospitalization. And again, what we've seen is patients who develop the AKI, as we call it, acute kidney injury after COVID, are also a group of patients who have bad outcomes, like more people, more higher mortality, more needing ventilation, mechanical ventilation, and so on. So either way, whether you have chronic kidney disease or acute kidney injury, COVID is bad. It just portends a bad outcome for these patients. And I don't want to leave out the transplant patients, because these patients are also very, very susceptible to complications from COVID. And the reason for that is they are very immunocompromised, just like our CKD patients, because they're on medications which suppress their immune system, their immunity in the body. So they're very prone to catching COVID, and they're very prone to having bad outcomes. So that's another group that we are very careful about.
Okay, so precaution is the word. Be aware of your surrounding, and like you said, take vaccination, take boosters, and pandemic is still going on. People who are not vaccinated, so let's all get vaccinated and make sure that COVID is a past history, and we can all say, hey, we lived in, B3 COVID. Wrapping up our conversation, that was really, really good information. Thank you so much, Dr. Acharya. So I just wanted to tell our listeners, if you are joining, we are on Facebook Live with eGlobalDoctors in conversation with Dr. Anjali Acharya about your kidney health. eGlobal is one complete healthcare platform solution for all your medical issues. And maze ki baat hai, you can be sitting at the comfort of your home, just have your phone with you, and with the click of your button, you can get all the consultation you need without breaking your bank balance and without going anywhere. LinkedIn, Facebook, Instagram, Pinterest, YouTube, Twitter, and eglobals.com पे आप देख सकते हैं, they are making lot of noise, and the right kind of noise is in this time around. So before I let you go, Dr. Acharya, any word of wisdom you want to share with our listeners?
Yeah, I just want to say kidney health is important. If you have any of the conditions that I mentioned, especially diabetes, high blood pressure, we didn't talk about the other conditions like obesity and old age, any of these which puts you at a higher risk for CKD, please take care of your kidneys. Ask your doctor how your kidneys are doing. It's a simple blood test and a simple urine test to figure it out. And get it done every year or every 6 months if you're at very high risk. And as far as COVID goes, take all the precautions. And as Kunjan, you mentioned, get your vaccinations, get your boosters wherever they're available. I know in India, they're not available yet, but when they become available, please do get boosters and stay safe, all of you.
Well, thank you. There you have it with this. This is Arji Kunjan signing off. Sayonara. Till we meet again, stay safe, keep smiling. Thank you, Dr. Acharya.
Thank you. Thanks for having me.